Hello, everyone. Today we are going to be reviewing my little TED talk on patient safety and um, nursing shortages and how it affects patient safety. Um, my name is Jeremy. I'm in evidence-based research um, for Adult Health 4. So, first thing I'm going to do is just summarize. So, over the last couple of years, with COVID-19, we've seen a serious decrease in nurses. Roughly about a third of nurses have left. And according to many surveys done with current nurses, it is projected that we're going to lose another one third, totaling to about 2/3 of current nurses leaving the field because of burnout, because of multiple different things. We as nurses, even nursing students, we practice patient safety above all, and we advocate for our patients. That being said, we're not going to work in a facility that has multiple issues pertaining to, patient safety issues related to um, mismanaged places or places that require a nurse to manage 8 patients at a time. So this is my research on this topic and how I plan to try to solve this. So for me, I would like to say um, the best resources I've found is currently being produced, especially through the American Nurses Association. This is basically a committee of nurses that advocate for nursing practices and to ensure the safety and the standard of nursing is withheld. So they have a wonderful advocating site for safe staffing. This can go everything from hospitals to community health nursing to even nursing in clinics. So what they recommend is that they make staffing committees within those levels of nursing, including the management, ensure a mandated ratio is withheld. So this being said, we can go through the different channels, and if need be, as nurses, we can team up and go to higher levels, such as like governmental or state, to try to fight for safe patient ratios. Now this is difficult because it's hard to judge a patient by what they are, how they're acting, because they could be fine 1 minute and then crash another minute. And that's something that we as nurses can't really predict. They just happen. But most of the time we can judge this and ensure that our patients are safe with the proper nursing care and nursing surveillance with assessments and medication management, everything like that. So I use the grounded theory for most of my research. Grounded theory is something that I truly believe in. This nursing research is based on. Grounded theory is basically understanding the basis to different things and seeing the reality of it. Because a lot of the times in nursing, we go back and forth between nursing management and theoretical things, or how it should be in the books, and even sometimes it comes down to numbers. But this being said, a lot of the issue right now is patients are being put at risk because nurses are leaving because of, it's like a whole cycle going on. So we as nurses need to try to figure out how to compensate this through either federally mandated registered nurse like ratios, a better system of determining acuity for patients, how much or how many patients a nurse can handle at a certain acuity. Now this acuity is determined in the ER and it can change, and it should be able to be changed and evaluated as the patient care changes. Just like we upgrade them from PCU or med-surg to ICU. That shouldn't change, and we should always make sure we change the acuity depending on their care, even if they're staying in med-surg. All right. So some internal evidence I have, in the links below I have a few different articles on nursing burnout, the reasons why we're having so much nursing burnout. This includes aging population, which is standard. Nursing burnout, which is a huge one as of late with COVID-19, and we need to try to work ourselves out of that scenario of pushing nurses to their limits and them breaking and leaving the whole career completely. Sometimes violence gets in the way of that. If they have bad management, that'll make a huge difference. But really, it's just the patient ratio that makes a nurse want to leave, because they can't safely practice under their license and maintain a happy medium with that. If they have a high patient load, there's no way that a nurse can manage all that and still go on day after day, especially if they work 3 days in a row. So there needs to be something done about this issue. I also put a link in here about federally mandated ratios. As I just spoke a little bit on it, I think that with the drive and with the social understanding of nurses now after COVID-19, we need to try to utilize this to make a federally mandated, or at least state mandated, law that states that a nurse can only handle so many patients, so that corporations and management and everybody doesn't run over nurses like they are now. Not all management's like this, and sometimes it comes down to having to do more than what we should. But for the most part, you shouldn't be coming in every day, working your butt off, never getting a break, caring for your patients on a 10-minute basis for each of them. Should at least have an hour at least in between each patient. And this includes management of the patient, assessments, charting, medication, talking to the doctor, updating. Us nurses do a lot of communication throughout healthcare, and it's getting rough. So we need to advocate for what we need as nurses to be safe for our patients, and make sure that our patients are not impacted by this issue. That being said, there's some ethical issues concerning this, especially right now with COVID gone or simmered down enough to where we no longer have government funding or anything like that. So a lot of corporations are starting to push higher ratios because they can't afford to maintain a low ratio. So this is an ethical issue that we're dealing with, and we're not being able to find nurses. That's another big issue that we're seeing in the field right now. I'll evaluate my change in this, and how I will operationalize the practice through after we do any federally mandated stuff, or state mandated, or even company mandated stuff. We can make that determination and evaluate everything afterwards to make sure that this has made a change in patient safety. As we all know, patient safety is our number one goal, and we would like to maintain that as nurses and be able to maintain our licenses and not be in fear of losing it. I'll disseminate my findings by collecting all the data, using quantitative data, and maybe even some qualitative data from nurses that have specific experiences with high ratios and how a lower ratio helps them better take care of their patient. And using this data, we can collect it all again and try to figure out if this solution has helped, or if we need to alter or tweak something, or a different part of the system to ensure that our patients are safe. But that'll conclude my stuff. I really hope that you guys look at the American Nurses Association website for advocating for staff safety, because that has a huge impact on everything that we do as nurses, including patients and their safety. We need to make sure we advocate for everything. And they have a long list of things. As of right now, the only federally mandated or state mandated patient ratio cap is in California. So we need to try to figure out something for the rest of the United States. But that'll conclude. Thank you.